Thank the distinguished chair for convening this hearing and for your leadership. And of course, thank Congresswoman Barbara Lee for her persistent leadership on this issue within the caucus, and thank all of the witnesses for your presence here today and for your testimony. It seems to me that tackling the issue of poverty should be something that we do in a bipartisan way. Jim Clyburn has frequently raised the issue of the need for Congress to address persistently poor counties. And when you look at the measure of what a persistently poor county is in the United States of America, it's based on the fact that 20% or more of the people have lived below the poverty line for 30 or more years. That's a persistently poor county. And when you look at who represents persistently poor counties in the United States House of Representatives, it's almost equally divided between Democrats and Republicans, both sides of the aisle. Haven't looked at the breakdown in terms of the 116th Congress, but in previous Congresses, in fact, my colleagues on the other side of the aisle represented more persistently poor counties than did members of the House Democratic Caucus. This is an issue that in the past, Dr. King has spoken eloquently about the effort to divide poor whites and poor African Americans from each other, notwithstanding the commonality of condition that can often be found. Dr. Barber, I'd be interested in your take on where the opportunities lie to tackle poverty as a moral imperative, as you've eloquently laid out for the country, but to try to do it in a bipartisan fashion.
First of all, I think that we have to, but I think all of us have to get this right. We're not talking about just addressing poverty a little bit. King talked about ending poverty, militarism and racism, and ecological devastation of war economy. That's why we've put together a budget as well as the facts. And the reality is, even with the facts, we got to start what's right. 140 million poor people. We got to stop racializing poverty. Like poverty is some black people that don't work that hard enough. The fact of the matter, there are more white people that are poor than there are blacks. In concentration, there's more whites, but it's actually more African Americans. And so we should come together. I was actually looking at the ranking member state in Arkansas. I just thought I'd look at Arkansas. I think this is Arkansas. It says that in Arkansas, 46% of people in Arkansas are poor and low income. 493,000 of them are black, but 863,000 of them are white. Now, all of those folks are not poor because they don't work hard enough. To have an anecdotal evidence about people working hard enough, they're actually proving our point. People shouldn't have to work 3 jobs. That's the point. People shouldn't work without health care. That's the point. Sure. People shouldn't have to pray to wait for food to come on their table. That's the point. If you're working, you should be making a living wage. You should have health care in the richest nation in the world. Every one of you that come into this chamber, one of the first things you get is free health care because we pay for it. We pay for it. You make sure that, for instance, you have the ability to all your pre-clearance. This lady didn't have that chance.
No.
She didn't have that chance. And so what we've put together for you is an agenda of what can happen if we invest in living wages and how many dollars that can put into the economy for everybody. What can happen if we cut the military budget by $350 billion, and it'll still be higher than Russia, Iran, North Korea, all of them combined. We have a complete plan. We're not here talking about Democrat or Republican. We're not trying to racialize, but that's why we disaggregated the number. We're tired of the racialization of poverty, the partisanism of poverty. What we are saying is you cannot have a society where 43% of your people are poor and low wealth. I don't care if they're from Eastern Kentucky, where we have been, that's predominantly white, or Eastern North Carolina, that's predominantly black. It is wrong, and we have a plan, and we must work together to change this.
Thank you, Dr. Barber. One last question. You also mentioned that the traditional poverty measures don't actually capture the distressed conditions that the American people are confronting in incredibly large numbers. And one of the statistics that has startled many of us, I believe, is the fact that at least half the country has indicated that they couldn't afford a sudden, unexpected $400 expense. That's over 160 million people in the United States of America. How do you think we should measure poverty? And maybe Dr. Theo Harris can address that, or Dr. Barber, I yield to you at your discretion.
I'm going to take one shot and turn it to, we have the official poverty measure and the supplemental poverty measure. The problem is even the official poverty measure didn't really measure poverty at the beginning. The supplemental poverty measure looks at poverty based on the federal poverty line, but also those who are less than 200% of the federal poverty line. And what it shows us is that that is a broader measurement. It gives us a truer picture. And if we're going to have this conversation, let's start with the facts, not the phoniness, not the mythology, but let's start with the facts of what's happening to 43.5% of the country. Liz?
Yeah, indeed. We actually need a more effective poverty measure. We need to not just talk about a food budget when housing is one of the biggest expenses, when healthcare and healthcare crises, when 73% of this country can actually have healthcare insurance and still not be able to afford many of their basic healthcare services, we got a problem.
Thank you.